Good afternoon. My name is Bridget Fernandez, and I wanted to thank the NLMA for putting together this press conference to try to explain to the public what the role of the medical genetics service is. And I'll just start by thanking Dr. Sean Connors, who's one of the cardiologists at Eastern Health, for agreeing to do the press release with me. And to my right is Ms. Patricia Canning, who's a patient who's been through the service. And I'd also like to thank these standing behind me are some of my colleagues, and they're physicians that regularly refer patients to the genetics service. So I'm one of two physician medical geneticists practicing in this province, and I was raised here. I went to medical school here, and then I did 5 years of residency training at the Hospital for Sick Children in Toronto. I took my first job here in St. John's, Newfoundland, 11 and a half years ago, and I've been had been the director of the Provincial Genetics Service for 10 years. In terms of the present workforce, we are two physicians, myself and Dr. Leslie Turner, and we work with 6 genetic counselors in St. John's and 2 genetic counselors in outreach clinics, one in Gander and one in Corner Brook. And together we deliver a province-wide service. We have 2 unfilled physician positions, and one of them has been there since 2002. So we face tremendous recruitment challenges, and the main problem is the small size of the medical genetics community in Canada. So I'm actually just happen to be the current president of the Canadian College of Medical Geneticists, and there are only 100 practicing medical geneticists in Canada. So I just wanted to say a little brief few words about the nature of the service. We work with high-risk obstetricians, seeing pregnant women who are carrying babies that have birth defects, and we help the obstetricians try to sort out whether the baby has a genetic problem or not. We do consults to the neonatal service, so we're seeing newborn babies with birth defects or severe medical problems like very bad seizure disorders that are suggestive of a genetic problem. In the pediatric world, we see children with intellectual disabilities, children that are losing milestones, children with autism. We see adults with neurologic diseases like Huntington's disease, and couples with infertility who need to have genetic testing before they'll be accepted for in vitro fertilization. But the 2 parts of the service that we wanted to talk about in more detail today are 2 adult components of the service. So there's the hereditary cardiac genetics clinic, and myself and Sean Connors working with Ann Williams and Dr. Shaw and Dr. Templeton, we run that service. And we have a wonderful genetic counselor who works with us there. And the other area we wanted to talk about was hereditary cancer genetics service, and Patricia Canning was seen through that service a number of years ago, and she'll talk to you about her personal experiences with the service. Okay, so I think I'll turn it over to Sean, and so Sean will speak for a little bit, and then Patricia, and then we're happy to take questions.
Okay, well, my name is Dr. Sean Connors. And I'm one of the cardiologists. I work at Eastern Health, and there's 8 or 9 cardiologists that work in Newfoundland. And as you know, in Newfoundland, we have a lot of heart disease. We have the highest rate of heart disease in the country, highest rate of hypertension, obesity, and diabetes. But the reason I'm here today is not to talk to you about heart disease in Newfoundland, is to talk to you about how, if Dr. Fernandez leaves, is going to impact my practice greatly. And it's going to impact me, and it's going to impact how I can deliver care to Newfoundlanders. So most of you know that people with heart disease, they have heart attacks, they have blockages and so on. But I want to talk to you about something a little different that we do in Newfoundland, and that we do very well. In fact, I think our team has put Newfoundland on the map, both nationally and internationally, because of the genetics work that we've done and the breakthroughs we made in this area. So it turns out that many traditional heart tests can't pick up disease at an early enough stage to save some people. And unfortunately, some of these people are young people, right? We have young people in this province that die. They don't know there's anything wrong with them, and they die before they have any symptoms. And to deliver care to that group of patients, you have to involve genetics and you have to involve DNA. In other words, you have to apply groundbreaking work and research and bring it to the clinical realm where you can treat these Newfoundlanders before they end up with problems. And we've done that very well, very successfully. In fact, we've actually discovered our own genes here in Newfoundland, and we've brought the results of that research to clinical application. So we've saved the lives of Newfoundlanders, and we've presented that work nationally and internationally, and we're well recognized for that here. Now, to continue to do that work, I can't do that in a traditional cardiology world. We need the help of Dr. Fernandez, because unless you can take the results from research and from DNA and from genetics and apply it to families and seek out these people and provide treatment for them, then you're not going to help them. You can't wait for these people to show up in the emergency room complaining of symptoms or pain, because it's too late then. So I feel my role here today is to tell you that if Dr. Fernandez is not part of our team, then we lose a very, very important part, the ability to appropriately apply genetics, research, treatment, assessment, and approach these families, and thereby deliver these patients into our hands so we can treat them appropriately. So one of the roles I have is to advocate for my patients. That's my responsibility. And when I look forward into the future without Dr. Fernandez, I know that my patients will be at a disservice. I can't bring those cutting-edge tools to the patients that I need to bring and the treatments I need to bring to them successfully. So it's not easy. You can't recruit someone like Dr. Fernandez of her caliber. You can't put an advertisement in the CMAJ and get someone to come here next week or next year. You know, whatever the difficulties, whatever the hurdles, we need to overcome them, because I'm here, I'm treating these patients, and I can't treat them as well as they can be treated and as well as we've proven that we can treat them in the past without her help. That's really the message I wanted to get across today.
Okay, thanks very much, Sean. And so I think I'll just turn things over then to Patricia Canning, who can talk to you a little bit about her personal experience with the genetic service and genetic testing.
Well, I'm here today to support healthcare in this province, and specifically the doctors in the Department of Genetics, like Dr. Fernandez and others. And many people in this province really, I don't think, know how much that department plays, what a vital role that it has played and continues to play in so many of our lives. I can say with all honesty and conviction that I would not be talking today, would not be here today, if it were not for Dr. Fernandez and the other researchers and physicians in the genetics area. In my family, there have been many early deaths due to breast and stomach cancer. When my generation began to approach 40, breast and stomach cancers appeared. Cousins died, others were diagnosed with cancer, and we seem to be repeating a pattern that we had seen in our father's generation. So after I was diagnosed with breast cancer, and a second first cousin died of gastric cancer, stomach cancer, shortly after that, I felt it just has to be a genetic problem. And I so often thought about the words that my father used to say. It's something in us, and it hits the women worse than the men. And those words were spoken long before the area of medical genetics was developed. So I called Dr. Green in the Department of Genetics, and I gave her a very brief summary of my family's medical history. And she right away asked me to come over to the genetics department. After that first visit, it was less than 2 months when I was notified by Dr. Fernandez that they had suspected a rare genetic mutation, and that they were then doing DNA analysis in order to confirm it. A few months later, it was confirmed that I had a very rare genetic mutation, and a female with that mutation has a 80% chance, and a male about a 70% chance of having diffuse gastric cancer, a cancer that is almost impossible, virtually impossible to detect in time for it to be treated.